See that hematopoiesis is it occurs in the bone marrow. So inside the bone you have the bone marrow. This area is the marrow. That is a spongy tissue, and that forms the cells. That's the blood cells in the bone marrow. And poiesis is generation, okay, or the production of cells in the soft tissue in the marrow. So you have the myeloid progenitor cells, and then you have the lymphoid progenitor cells. So in the another slide I'll be discussing about lymphoid progenitor cells. In this slide we'll discuss a myeloid progenitor cells. So what are the cells which are produced from the myeloid series? So let's first discuss a platelet, how platelets are formed. So by definition guys, blast, the meaning of blast means it is a premature cell. It is a premature cell, that's a blast. And when the vignette is talking about cyte, that means it is a mature cell. And also you can see that the blast cells are more blue in color, okay. So blue in pathology is basophilic. So they are more blue and they are premature cells, and the cytes are mature cells and they are lighter in color. If you look at the megakaryoblast, mega means a big cell, premature cell, where the nucleus is big and the cytoplasm is blue. And then the vignette is going to tell you that it's a large cell with a you can see the lobes are multi-lobated. So they are called multi-lobated cell. And this is a megakaryocyte, which is maturing from megakaryoblast, a blast forming megakaryocyte, and then ultimately the promegakaryocyte will ultimately form the megakaryocyte. So how the platelets are formed from the megakaryocyte? So the platelets are formed from so this is the cytoplasm of a cell, and this is the nucleus. So the platelets, it's very important to know that the platelets are formed from the breakdown of cytoplasm of the megakaryocyte. Okay, very important. Breakdown of cytoplasm of the megakaryocyte. And again, the platelets are important in hemostasis. That means if someone has any cut, so it will help in stopping the bleeding. It plays an important role in primary homeostasis and secondary homeostasis. So that's a different topic in first aid guys, and I will again try to make that video. So these platelets, the lifespan of platelet is 8 to 10 days, okay, and it plays an important role also in thrombotic thrombocytopenic purpura, idiopathic thrombocytopenic purpura, gallbladder disease, Werner sequelae, and Glasgow's thrombocythemia. So that's all the pathology. We are not going to discuss this as we are discussing the platelets and the normal lifespan. So 8 to 10 days is the lifespan and plays an important role in stopping the bleeding. It also has many granules like fibrinogen. It releases granules, ADP granules, fibrinogen, all those things. Okay, so that also plays an important role in homeostasis. So what we learned from the platelet megakaryocyte, that a megakaryoblast, a blast is forming a promegakaryocyte which is multi-lobated, and then it is forming the here you can see it is forming the megakaryocyte and then forms the platelet, and platelets are formed from the breakdown of the cytoplasm with a lifespan of 8 to 10 days. Now coming back to the normoblast, okay. So this is a normoblast. What happens? How RBCs are formed? RBCs are not directly jumping from the bone marrow into the circulation, guys. So what happens? By rule, remember an important concept here, that Premature cells, except the megakaryoblast, premature cells are larger in size compared to compared to the mature cell. You see that? If I show you here, look at this premature cell. This is larger compared to this mature cell. Okay. So as they mature, the cell size becomes decreased. That's very important concept. Why it is important, when we'll discuss another topic again, I will try to make a video on it, like in B12 and folic acid deficiency, which is responsible for maturation of the nucleus. As a result, the cells appears big on the peripheral blood smear. Okay, so premature cells are bigger than the mature cells. Okay, and you can see the cytoplasm of this premature cell. The cytoplasm is blue. Okay, and the nucleus is bigger. Gradually the nucleus will become smaller in size. That first is the pronormoblast. As I said, blast is a premature cell. Again, a blast is a premature cell. Then ultimately you can see the color is changing in the cytoplasm. Ultimately the color is changing with polychromatic. Now what is poly means many, chromatic means colored. Normoblast is a premature cell. So the color is changing from blue to it is trying to get the color of the RBC gradually. And then orthochromatic normoblast means, guys remember, here the nucleus is trying to come out of the RBC, premature RBC. Okay, so now it forms the reticulocyte. So reticulocyte do not have nucleus. So what does it has? It has very important concept, guys, for step 1 and CK. It has a rRNA. It is rRNA, and these reticulocytes are stained where they are stained with right gyms are stained. Very important. Okay. So what is the importance of reticulocyte? If you are getting any VNAT, if you are doing any VNAT, I would say in any condition, if normally the reticulocyte is 0.5 to 1.5%. Okay, so the bone marrow is forming the reticulocyte. So if the bone marrow is not formed, bone marrow cells are not formed, for example, as you can see in aplastic anemia, due to radiation or anything where there is no cells are formed, only there is a fat cells. Okay, so in that condition the reticulocyte will go down. Okay, or in conditions, what are the conditions where the reticulocytes will go up? Reticulocytes will go up is any hemolytic disease, any hemolysis. For example, any condition where is more and more destruction of RBC in the peripheral blood smear. For example, in iron deficiency anemia, for example, in any sickle cell anemia, thalassemia, there will be more reticulocyte. Why? Because the bone marrow is trying to form more reticulocyte to form more RBC. That's to compensate. So it's very important, guys, that in an aplastic anemia, the reticulocyte count is decreased because the bone marrow is not forming at all, maybe due to radiation, and the bone marrow is replaced by the fat cell. In myelofibrosis, myelom is bone marrow, fibrosis means fibrosis of the marrow, where the cells are not formed, so you are not expected to see reticulocyte. Okay, so it is very important. In hematology, guys, if you know the concept, you can answer in seconds anything with the picture. Okay, if you know the concept, you can answer them. Okay, so reticulocyte decrease in aplastic anemia, increase in any hemolytic disease. Okay, so what we learned here, we see that when the RBCs, the premature RBCs are the blast, the cells are bigger. Once it get mature, they become smaller, and the nucleus is trying to come out of the RBC. Okay, and that is orthochromatic, means it's trying to get the color of the RBC. Okay, and then the nucleus is trying to come out of the RBC. Okay, and then it forms the reticulocytes, that is the without the nucleus, no nucleus, because the nucleus is already come out here. Okay, and that's it contains what is called this granules or rRNA, which is stained with the right chain cell stain. Okay, it also stained with methylene blue stain. Okay, methylene blue stain. So the next which is formed is the RBC. RBC, normally the size of the RBC is 7.2 micron, guys, and then this RBC has a central, you can see this central one third, only one third is paler. That means what, all this portion is hemoglobinized. They have been hemoglobinized. Okay, so the lifespan of the RBC is, what is the lifespan? That is 120 days for adult, and you can see in 90 days for neonates. Okay, so that's the lifespan of the RBC. So RBC, after completing its lifespan, it goes to the spleen for destruction. Okay, so that's called the senescent or the old RBC. Okay, and then RBC do not have nucleus, do not have mitochondria. So mitochondria, as you all know, guys, that mitochondria is a powerhouse of the cell. So because it's a powerhouse, it should generate ATP. But since the RBC do not have mitochondria, it doesn't have ATP. So how does it get its energy from? It gets its energy from the glycolytic pathway, through the process, through the metabolic pathway, where the phosphoenol pyruvate is converted to pyruvate by the enzyme pyruvate kinase. Okay, and that will generate ATP, which is utilized by the RBC. Okay, for example, let's say this person he doesn't have this pyruvate kinase enzyme. So what will happen? So if he doesn't have this enzyme, he is not generating ATP. So as a result, the RBCs are not getting enough energy, and they become rigid, and they get damaged. Okay, so that is like a hemolysis, and then that's an important concept to differentiate pyruvate kinase from G6PD, guys. So here I'm just talking about the normal cells. I'm not going to discuss that here. Alright, so one important thing you should know, that in a pyruvate kinase deficiency, the person is more prone for hemolysis because the RBCs are not getting the ATP. Okay, I hope that makes sense. Now we saw the platelet formation, the RBC formation. Now we will focus on the myeloid progenitor cells. Okay, from that same myeloid progenitor cells, as we discussed here, let me show you again. These myeloid progenitor cells, which form the platelet, which form the RBC, they also form the myeloblast. Because there was no space, so I have to draw the picture here. So this myeloblast again is a premature cell, and as you know, as I said, that the more premature a cell is, the size is bigger compared to a mature cell, except the megakaryoblast and the megakaryocyte. Okay, megakaryocyte is larger than the megakaryoblast. Okay, so you can see the nucleus is so big. So this is a nucleus, this is the cytoplasm. Okay, and this portion is the, inside the nucleus is the nucleolus. So what is important for myeloid series of cells? The important thing here is the premature cells are larger compared to the mature cells. They have a nucleolus. You can see the promyelocytes and the myeloblast, these two cells. You can see the granules in the cytoplasm. And they are positive for a special stain called myeloperoxidase stain. so they are positive for that. Okay, so this is an important differentiating point from myeloid. In the next slide I'll be talking about lymphoid. How will you differentiate myeloid and lymphoid cells? And for if you know that concept, again you will not get confused with lymphoid and myeloid series of cells. Okay, whether it is ALL or AML, because I see that a lot of the students in our tutor sessions, they get confused. Okay, so after the session they said that okay, now it really makes sense that how to differentiate myeloid and lymphoid and different types of leukemia and their pathology. Okay, so the cells are larger, they have nucleolus, the granules in the cytoplasm, you can see this, and they are positive for myeloperoxidase stain. Okay, so now let's go back and understand each cell. So from the myeloblast, if the cell is trying to form a myeloblast can form a basophil or neutrophil or a eosinophil. Okay, so in a promyelocytes, you can see the cell is baked with the cytoplasmic granules here. Okay, similarly basophil means blue, guys, so that's a blue, and then they form the myelocyte. Now the myelocyte here should have been somewhere, this picture should have been somewhere here. So the myelocyte will have a eccentric nucleus. That's a very important, and the vignette is going to tell you that it should have a eccentric nucleus. That means that its eccentric means not exactly in the center, away from the center, you see that. So myelocyte, they'll tell that the granules, they have a dense blue granules and they have an eccentric nucleus, so that's a myelocyte. Okay, and if the morphology says that the is a metamyelocyte, actually there should have been an indentation here like this, because in basophil it is difficult to see the nuclear morphology. I will write it here. Basophils, it is difficult to see the nuclear like this nuclear morphology. Why? Because the granules are obscuring, granules are hiding this nuclear morphology. Okay, so they are obscuring or hiding the nuclear morphology. Okay, obscuring the nuclear, already I wrote it here. Okay, nuclear structure or nuclear margin, I would say. Okay, so that is why the granules are so much that you cannot see the lobes. Normally they have two lobes, in the basophils. Okay, you can see here, so they have the two lobes. Again, this is a band form, you cannot see that because the granules are obscuring them, and these are the two lobes in the basophil. Similarly, when we talk about neutrophil, the neutrophils has, this is a promyelocytes, the neutrophilic promyelocytes. I forgot to mention something important here, guys. So basophils plays an important role in, just like basophils and mast cells, they both, the basophils and the mast cells, they both arise from the same progenitor cells, that is myeloid progenitor cells. It's a very important to know that, because they arise from the same precursor, but they are not the same cell type. They arise from the same precursor. That is important. If you look at this one here, look at this. It is arising from the myeloid cells, but it is not the basophil. It is not the basophil. So that is what I wanted to explain here. And then basophils plays an important role in CML, chronic myeloid leukemia, and also in allergy. Okay, allergy, where they release tryptase, very important. Okay, and histamine. So normally the basophils in the blood is not even 1%, guys. It is 0 to 0.75%. But in chronic myeloid leukemia, its number can increase up to 5%. So any vignette, if you are getting 5% basophils, think of, are you dealing with chronic myeloid leukemia in that vignette? Okay. So the next one is a neutrophil promyelocyte. So promyelocytes are again the last cells from the myeloblast. They have lot of granules with nucleolus with a nucleus here, and then they form promyelocytes. Yes, this is very important topic for step 1, step 2, step 3, all of them. So normally we have different types of leukemia, guys. I'm not going to go in this in detail. They have leukemia M0 through M7, and in an acute myelocytic leukemia, as you all know, that is AML M3, that's a promyelocytic leukemia, where the cells are not maturing. See, there is a more than, by definition, if you get more than 20% cells, blast cells in the bone marrow, we call it as AML, right? So these cells are not maturing, they are stopped here. So we give what is called vitamin A, okay? So vitamin A or retinol or transretinoic acid is given to what do you call, the vitamin A is given to mature these cells, okay? So that's important concept again, okay? So when you give vitamin A, the promyelocytes will become myelocytes, metamyelocytes, all those things, and then they form the myelocyte. Again, the myelocyte, the vignette is going to tell there's an eccentric nucleus with the granules in the cytoplasm. So for a metamyelocyte, that will be a indentation like a kidney bean shaped, okay, like a kidney bean shaped. So that's a metamyelocyte. So myelocyte is an eccentric nucleus. Metamyelocyte, there will be an indentation, and then the band form. You see, the band form will be like almost like a loop, like a half moon shaped, okay, and then forms the neutrophil, very important. Then forms the neutrophil. Neutrophils are normally 3 to 5 lobes. They are connected by, these are the chromatin threads, they are connected by the chromatin threads, and then 3 to 5 loops, okay? So what is the function of neutrophil? What is the normal percentage of neutrophils in the blood? Normally they have 55 to 62% of neutrophils in the peripheral blood, and then this is increased in any inflammatory conditions, and that is what is called like when they are increased in inflammatory conditions, these granules, which are very fine, very important concept I would like to draw here. So if you can see a neutrophil with very big toxic granules in the cytoplasm, like these big granules, that's called toxic granulation, and that's the important concept if there is any kind of inflammation. And on any inflammatory condition, you will see Dolly bodies, okay? And I'm not going to go in detail about all those things, guys. Dolly bodies and toxic granulation are indicative of inflammatory conditions of neutrophils, and they are also called a phagocyte. They are called a phagocyte because they play an important role in engulfing the bacteria, okay? So again, left shift. What is left shift? That means the neutrophils in the bone marrow will be shifting to the peripheral blood in conditions like chronic myeloid leukemia, all right, and it is increased in any bacterial infection. So that's the importance of neutrophil. And they also has a granules called the eosinophilic granules, which eosinophilic granules are also, like here you can see in the promyelocyte, these eosinophilic granules, sorry about this, eosinophilic granules, when they fuse, they form the hour rods, okay? And that is, you can see one of the important characteristic of AML M3, okay? And then of course they are myeloperoxidase positive, all right, very high for step 1 and step 2, guys. So that's all about neutrophil. Let's go and discuss about the eosinophil. The same thing here. It is coming from the myeloid progenitor cells, the promyelocyte, okay? Then the same nucleus with the brick red cytoplasm, they have the brick red granules, and then the myelocyte with the eccentric nucleus, the metamyelocyte with the indentation, as you can see the indentation here, all right, and then it forms the band form. The same concept, forms the band form and forms the mature eosinophil, Eosinophil, how they are characterized? Eosino means pink, basophilic means blue. So they have a brick red cytoplasmic granules. Why these granules are important and why they are increased in parasitic infections? Because these eosinophils have these brick red granules. These granules have what is called the helminthotoxin. That means it kills the parasite. As a result, the eosinophils in the blood are increased in any parasitic infections. Okay, so normally the eosinophil is 0 to 3%, so it may increase even in 50% in any parasitic infections. It can be also increased in adrenal disease, adrenal pathology, in asthma, in allergy. Okay, so all those things, right? Then you have the next one is the monoblast. As we already discussed, the blast is the premature cell. The monoblast, you can see the nucleus is eccentric and they have this what is called the spongy cytoplasm, or they call it as a frosted glass cytoplasm, like a sponge. Okay, so you can see this is a promonocyte, and the monocyte, you can see this like the holes, like when you see a sponge, they have holes in the cytoplasm, and that's called the monocytes. The monocytes are in the blood and macrophage in the tissue. Okay, so how do you recognize macrophage? So they will have something like a wavy cytoplasm with the central nucleus, and they also have this sponge like cytoplasm. Okay, or holes in the granules, or holes in the, not granules, I would say holes in the cytoplasm. Then you have the dendritic cells. Okay, they are the phagocytic cells, and they appear like a star. Okay, so that's a dendritic cell that is formed from the monocyte. So what is the function of a macrophage? A macrophage is a phagocytic cell. It plays an important role in MSC, okay, membrane histocompatibility complex 1 and 2, alright, and it also plays an important role in toll-like receptors. Its job is it go and attack to the gram-negative bacteria, lipopolysaccharide of the gram-negative bacteria, so can engulf the bacteria. And what is the marker of the macrophage? That's CD14. CD14 is a macrophage marker. Okay. Then let's go back and discuss the lymphoid precursor cells. Okay, so now the lymphoid precursor cells. So this is the hematopoietic stem cells again. In the previous slide we saw that the hematopoietic stem cells are divided into myeloid and lymphoid. Myeloid progenitor cells and the lymphoid progenitor cells. So from the myeloid we saw that they form the platelets, RBC, then the myeloblast, which form the basophil, eosinophil, neutrophil and monocytes. Okay, now in this slide we are going to discuss the lymphoid progenitor cells. They form the lymphoblast. Again, the blast is a premature cell. Okay, and what is the difference between morphology? When you look at the slide, how will you easily identify a slide? Do you see any granules here? No, there is no granules. So let me write here, guys. Let me write here. So in a lymphoid, like we saw in the previous slide, myeloid, in the lymphoid, how will you recognize the cells? The premature cells are bigger compared to the mature cell, and the cytoplasm is less compared to the myeloblast, okay, or myeloid series of cells. And then no granules except very little you will see in the NK cells, okay, which I'll discuss. And they are negative for myeloperoxidase but positive for periodic skip or pass stain. They are positive. Okay, if you know this concept, guys, it will be so easy for you to exclude the other options and you can answer the question faster. So our rods are negative, okay, because there is myeloperoxidase is negative, our rods is negative, because our rods are nothing but fusion of the eosinophilic granules, and eosinophilic granules you will see in the cytoplasm of the neutrophil or a promyelocyte. So when these granules, so let's say this is a neutrophil, okay, or a promyelocyte, neutrophil or a promyelocyte. So if the neutrophil, let's say a neutrophil here, so it has these granules. When the granules they fuse, they become the our rods. Okay, this is the neutrophil, because neutrophil is formed from the promyelocyte, isn't it? So even the promyelocyte, the granules they fuse to form the our rods, and that's AML M3. Okay, so very important, you should know this concept to exclude myeloid and lymphoid. See, there is no granules, you don't see any granules. Okay, and then nucleolus, even if it is there, maybe one or two, compared to the nucleolus 2 or 3 you see in the myeloid series of cells. Okay, so this is the lymphoblast with a very little cytoplasm compared to the abundant cytoplasm of the myeloid series of cells. No granules. Okay, and then if you see, they form the myeloblast will form the pro-lymphocytes. Okay, and then I'm sorry, I have told the myeloblast, guys. I wanted to tell lymphoblast, which will form the pro-lymphocyte and ultimately form the small lymphocyte. So small lymphocyte, as the name suggests, is small and the cytoplasm is very little. So they will form the B lymphocytes and they also form the T lymphocyte. So what is the important concept here? As we discussed previously, in the bone, so we have the, in the bone you have the soft spongy structure called the marrow. Okay, and in the marrow the B cells and the T cells are formed. They are formed. So these B cells, they are formed in the bone marrow and they are matured in the bone marrow, and then they go to the lymph node. When they come in contact with the antigen, okay, they will stimulate, the B cells will stimulate the plasma cells to produce antibodies like IgG, IgA, IgE. Okay, so it's very important that when a B cell comes in contact with the antigen, it will stimulate the B cells to produce plasma cells, and plasma cells will ultimately produce the antibodies IgE. You can remember like A is a mnemonic, AGE. Okay. The T cells, they are formed in the bone marrow. They are formed in the bone marrow and they are matured in the thymus. Okay. What is a thymus? It's a lymphoepithelial organ and they are matured there. Okay. So we saw that how the small lymphoblast will form the lymphocyte. With the small lymphocyte, no granules, very little cytoplasm. Ultimately they form the B lymphocyte, T lymphocyte. B lymphocytes are formed in the marrow, matured in the marrow, comes to the lymph node, and then T lymphocytes are formed in the marrow but matures in the thymus. Ultimately they form the negative and positive selection, which is the immunology chapter, guys. Again, I am not going to discuss here. And these B lymphocytes ultimately form a plasma cell, which is important in disease like MGUS, monoclonal gammopathy of undetermined significance, and multiple myeloma. Okay, a lot of the students, they learn multiple myeloma but they forget MGUS and Waldenstrom's macroglobulinemia, which is very high for all the steps. Okay, so they are going to tell you that there is a oval cell, okay, with an eccentric nucleus. That means the nucleus is in the periphery, and there is a perinuclear, peri means around the nucleus, perinuclear clearing. Why that is there? This is an important concept. That is due to Golgi, very high yield. That's due to Golgi, and it has like a clock phase. The chromatin in the nucleus will look like what is called the clock phase chromatin. Alright, very important concept is that the the plasma cells are not seen in the peripheral blood. They are not in the peripheral blood. They are normally present in the bone marrow. Okay, they are present in the bone marrow, and more than 10% plasma cell proliferation, okay, signifies that the patient has multiple myeloma. If it is MGUS, then it is less than 10%. Okay, so here you will see graph findings like hypercalcemia, renal abnormality, anemia, nomocytic anemia, and bone pain, which you don't see it here. No graph finding, and there is less than 10% plasma cell. Here you will see more than 10% plasma cell proliferation. Okay, and then from the prolymphocyte, again, another cell which is formed is the natural killer cells. Okay, so these natural killer cells, they are the cells of the innate immune system which you are born with. Okay, so adaptive immune system cells are like B lymphocyte, T lymphocytes, antibodies which are adapting in later life. Innate immune cells are like neutrophils, eosinophils, macrophage. Those are all the innate immune cells. Okay, so these NK cells, they are recognized by CD56 and CD16, unlike macrophage which are recognized by CD14. And these NK cells plays an important role in antiviral and anti-tumor properties. Okay, that means they plays an important role in killing the virus and killing the tumor. So what are the other cells in the body which plays an important role in antiviral and anti-tumor property? It is the CD8 cell. So normally the T cells, as we saw here, this T cell can form CD4 and CD8 cell. This CD8 cell is called cytotoxic cell, and this cytotoxic cell can kill virus and tumor just like the NK cells. Okay, so remember that NK cell and the CD8 cells has both antiviral and anti-tumor properties. Okay, CD4 is called the helper T cells. It helps the B cells to produce antibody. Okay, so guys, so today what we learned is what is hematopoietic stem cells. The hematopoietic stem cells are forming the myeloid and the lymphoid stem cells. Myeloid cells produce the platelets, RBCs, mast cells, the monocytes, and the lymphoid progenitor cells plays an important role in lymphoblast, and then that form the lymphocytes and NK cells. And again, I forgot to tell him one important point. These small lymphocytes plays an important role in CLL. Okay, CLL, chronic lymphoid leukemia, and then the lymphoblast plays an important role in ALL, which is mostly seen in Down syndrome. Okay, and in the previous slide here we saw that that this myeloblast, you can see this cell, here, this myeloblast, if there is more than 20% of blast cells in the bone marrow, we call it as AML. Okay, AML. So irrespective of myeloblast or a promyelocyte, any of them. Alright. So guys, in the today's session, we saw all the hematopoietic cells, stem cells, how they are formed, and what are the pathologies which are associated, what are the leukemias, inflammations which are associated with, how platelets are formed, what is the lifespan, all those things. And I have correlated the biochemistry, hematology, and the other pathophysiology concepts, which is going to help you. And try to remember how do you identify myeloid and the lymphoid cells, its morphology. If you are very good with this, guys, believe me, you will answer the vignette in seconds. Okay, so anyone again interested to take the course with us, that is dressmd.com, I'm going to link in the website and the phone number. You can WhatsApp us, and please join our demo session and see that how we are taking session. First step one, entire first aid explain on whiteboard, and for CK we have the entire U world. Okay, for step one, if we are taking the entire first aid, we are correlating the vignette, not only understanding the first aid but making in a way that whenever you are dealing with step one concept, it is very easy to correlate how this first aid page you can have different vignette. Okay guys, so try to join. If you like, you can enroll. All right, thank you so much and take care guys.